Stroke happens all of a sudden. As the word suggests, it hits and hits all of a sudden. There will be a sudden change in some aspect of normal neurology. So the common way which we suggest people so that they can remember is to use the acronym FAST. F for face. To look at the face, is there any asymmetry? Once it happens, the symptoms may be very subtle. So ask the person to smile. And if one side of the face is not moving or drooping, so that's an early sign of stroke. Second thing is arms, A. Ask the person to lift both arms. So if there is any weakness or drooping on one side, so that's a sure sign, if it has happened suddenly, that it may be because of a stroke. The third one is S, speech. Ask the patient, ask the person to speak something, ask his name, or ask him to repeat, the sky is blue. So if there is some slurring, or if he is sort of dazed and not able to understand, or he is able to understand but can't speak it out, so that's one sign of stroke. And T in fast corresponds to time. You have to immediately get alerted if you see these symptoms in a person close to you, and immediately you will have to rush him to the nearest medical center, because in stroke, time is brain. As early as the blood flow is restored to the critical areas of the brain, that much of brain tissue we can salvage, we can help to regain whatever is lost. So in that critical hour, so that's why it's called golden hour, and we have to take immediate action, not to wait that it will pass off. Sure, in some cases it passes off. For some people it happens for some reason, they would be alone and they have not noticed, it would have come and gone. Even sometimes a kind of blackening, sudden blackening of the vision, and then it comes back. So they think it may be something trivial, but those are some signs which may be a sign, which may be a harbinger of a bigger thing to come. So even if these, whatever I said, happens and then recovers, but you have to take action so that the next time when it happens, it can happen sometimes in crops, it can happen as stroke in progression over a period of time. So even if it comes and goes, it's necessary to take immediate medical attention. And when we say medical attention, it's of varied different treatment modalities. So if it is a big stroke, an occlusion, blockade of a major brain blood vessel, we may have to go in there through interventional methods to retrieve the clot so that blood flow is restored. Or we may have to give injections to dissolve that clot which is obstructing the blood flow to the brain, to restore the blood supply. If it is because of a bleeding inside the brain, there are other modalities of treatment, controlling the BP, keeping him in intensive care unit so that further episodes, further worsening does not happen. And if such bleeding is because of any weakness of the blood vessel, like cerebral aneurysm or an arteriovenous malformation, so that will require a specialized further treatment to obliterate that weak spot in the blood vessel of the brain. So with the advent of this modern technology, most of these strokes have some tremendous capacity to be reversed and made better and restored to their normal life. So there are some unfortunate cases where in spite of these measures, we may not be able to bring back the person, but there are ways to reduce the impact of stroke so that they can be finally be amalgamated back into the society and to rehabilitate them back to what they were doing earlier. So there are a lot of advances in stroke management. But for now, a message for everybody is to remember that time is brain, and whenever you suspect something like what I said, fast, face, arms, speech, Remember, time is brain and immediately rush the person for medical attention.